For the compression of the abdominal aorta, you should be familiar with the anatomy of the abdominal aorta. The aorta is the big artery which brings blood from the heart to the lower parts of the body. When it passes the umbilical level, it bifurcates into two different portions, one to the left leg and one to the right leg. When a woman is lying in a horizontal position, the aorta runs in the midline. It lies on the hard skeletal structure of the vertebral column. In order to switch off the flow of blood to the uterus, we need to apply pressure on the aorta from the abdominal side and compress the aorta between a closed fist and the vertebral column. Before making any compression, we must also be aware of the anatomical features near the abdominal aorta. For example, if we compress too far up, it can be painful because we might be pressing the liver edge. If we press too far down, it will not cut off the blood flow. We should also keep in mind the position of the uterus. Fortunately, the position of the umbilicus roughly corresponds to the part of the body where the aorta bifurcates and where you need to make the compression. The first step in this procedure is to localize the femoral artery in the right groin. Using your right hand, put 3 to 4 fingers in a horizontal position and firmly put pressure on the femoral artery in the right groin. Make sure that you can clearly feel the pulsations there. You must do this to monitor blood flow to the lower parts of the body during the compression. After confirming the pulsation with the right hand in the groin area, close your left hand into a fist. Make sure that the thumb is outside and not inside, in order to create a plane surface which will create a good area for compression. And then, very slowly, at the level of the umbilicus, press your closed fist down until you clearly feel the pulsations of the abdominal aorta. If you do not feel the pulse of the abdominal aorta, move your closed fist slightly to the right or left until you locate it. Then push your closed fist further down, compressing the abdominal aorta between the fist and the anterior wall of the vertebral column. If the compression is successful, the right hand will feel the femoral artery pulse disappear. Once the femoral pulse is gone, it means blood is no longer being delivered to the lower parts of the body, including the uterus. This will result in reduced blood loss. If your hands become tired, it is simple to switch the hands by moving to the other side of the patient. After confirming that the compression was successful, continue to apply pressure in the same location and make sure to constantly monitor the femoral pulse. There is nothing dangerous about this technique. Since there is substantial collateral circulation in the pelvic area, there will be no risk of reducing blood flow to other pelvic organs, while continuing abdominal aorta compression for hours, even during transport to an emergency obstetric care center, if need be. For this technique, it is important to keep in mind that the compression of the abdominal aorta in a postpartum patient is much easier than on a volunteer. This is because, 1. Since the woman has just delivered, the abdominal wall does not offer any muscular resistance to a compressing fist. 2. Due to shock, the woman might even be semi-conscious or drowsy. And 3. A woman who has just delivered and whose uterus is bleeding uncontrollably will be in hypovolemic shock, and her arterial blood pressure in the aorta will be much lower than normal. This allows the compression of the abdominal aorta to be performed more easily. Let us now review the steps for this technique. 1. Localize and feel the pulsations of the femoral artery in the right groin. 2. Compress the aorta at the level of the umbilicus between a closed fist and the vertebral column. 3. Confirm the disappearance of the femoral pulse in the right groin. 4. Continue to apply pressure and continue to monitor the femoral artery. Always keep in mind that the compression has not solved any other problems related to or causing postpartum hemorrhage. It has only reduced blood loss.